President, I want to speak, if I might, for a few moments this morning about a subject that is on the minds of many Americans, and I think that should be on the mind still of everybody here in this chamber, because the impact of the health care bill that was passed and signed into law recently is going to have impacts across this country for some time to come. And I'm interested in the discussion that's occurred here on the floor of the Senate over the past several weeks, as Senator Barrasso from Wyoming, who also happens to be an orthopedic surgeon, is a physician, has come down to the floor to engage in a series of remarks, what he calls the second opinion. And I think his second opinion series of remarks here on the floor has been extremely well pointed in illustrating, I think, in many respects, what's wrong with the health care bill and why this is not something that's going to improve the lives of most Americans. In fact, it's going to worsen the lives of most Americans, because they're going to be faced with higher health care costs, higher taxes, and probably higher deficits for years and years to come. And there's lots of supporting data now and validation of those arguments that have come out. Of course, we heard during the course of the health care debate from the Democrats who were supporting it and the President that this was going to, one, reduce health care costs for most Americans, two, reduce the deficit, and of course they talked a lot about how it was going to extend the lifespan of Medicare as well, even though they were cutting Medicare to create a new entitlement program. So all those promises that were made by the President, by the Democrats here in the Senate when we were debating health care, are now all being completely rebuffed by evidence that comes out all the time from those who study this issue closely. And frankly, as we get more and more businesses who are trying to figure out how to interact with this new health care legislation, are coming to the conclusion that it might be cheaper for them in the long run just to drop their coverage and put everybody into the government-run plans, which is what we predicted would happen all along. But I think the most probably, I don't know, you call it a bombshell, but certainly the most damning piece of evidence that came out here was a few weeks ago, when the HHS actuary, the Health and Human Services actuary, came out with their analysis of the new law once it had passed and the financial impacts that it would have once implemented. And I want to just share with you a few things from that report, because I think it's really important. It does, as I said before, illustrate exactly what my colleague from Wyoming, Senator Barrasso, others have said, what we said throughout the course of the debate in the Senate when health care was under consideration here. The actuary at the Health and Human Services Department, and bear in mind this is they're supposed to look at these things in a totally objective, non-political way, but the actuary concluded that the federal government in the country will spend $310 billion more under the new law than we would have without it. Now, they went on to say that the national health expenditures would increase from 17% of GDP, which is what it is today, to 21% under the new law. Now, what's interesting about this is that the $310 billion increase in health care costs that they now say will result from the passage and implementation of this legislation is more than what would happen had we done nothing. Had this body done nothing in terms of health care reform, health care costs would have gone up less than they will with this legislation, which, as I said before, completely refutes any argument that was made by the other side during the course of this debate that their legislation would, in fact, drive down health care costs. The actuary is now concluding what we did over and over, the point that we made throughout the course of the debate, and that is that health care costs will go up, not down. The cost curve will be bent up, not down, and that for most Americans, health insurance premiums are going to go up as a result of this legislation. And that's what the actuary is now saying. Now, what's even more interesting about that report is they went on to say that health care shortages and price increases are, quote, plausible and even probable under the legislation, and suggested that there would be perhaps as many as 15% of party providers or hospitals that would become unprofitable within the 10-year projection period absent further legislative action. So in other words, up to 15% of hospitals would have to close as a result of this legislation. And because of that, the report says that the law will jeopardize, and I quote, access to care for seniors. So all these promises about greater access, lower costs, and the promises that were made during the course of this debate are being completely now rebuffed by the report that the actuary came out with just a couple of weeks ago. Now, the other thing I think is important, because we emphasized this as well during the course of the debate, the actuary also concluded that the new taxes that are going to be imposed on medical devices, on prescription drugs, and insurance plans would generally be passed on through to health consumers in the form of higher drug and device prices and higher insurance premiums. Now remember, during the course of the debate, we said that all the new taxes that are going to be levied on medical device manufacturers, pharmaceuticals, health insurance plans would be passed on. And this is clearly what they're suggesting as well. And so not only do you get the double whammy, you get the whammy of higher insurance premiums, but you get the double whammy of higher taxes that are going to be borne by a lot of people across the country. And that also is substantiated and supported by the Joint Tax Committee, which took a good look at the distribution of the impacts of the tax increases in this bill, that a lot of Americans are going to see their tax burdens go up as well. Now, with respect to the issue of the deficit, which again is something, I will get to that in just a moment, but the actuary notes that the bill's Medicare provisions, and I quote again, cannot be simultaneously used to finance other federal outlays, such as the coverage expansions, and to extend the life of the Medicare trust fund, despite the appearance of this result from the respective accounting conventions. And essentially, what they have said is what they said in a letter in response to questions that we posed about how this would impact Medicare Trust Fund, and the CBO, or basically the actuary is saying what the CBO said, and that is that you're double counting revenue, that you're basically spending the same money twice. So in other words, all the additional revenues that are supposed to become available because of reductions in Medicare benefits or increases in Medicare payroll taxes that we're going to extend the lifespan of Medicare and also be used to finance the new health care entitlement program, that is what we said all along it is, and that is double counting. You can't spend the same money twice, and as a consequence of that, you're going to see the deficit picture, what they promise in terms of deficit reduction is going to be very different from what actually happens. And they went on to say, because of the new Class Act that was created, which is the long-term care entitlement program, which was described, believe it or not, here on the floor by one of my Democrat colleagues as a Ponzi scheme of the highest order, the kind of thing that Bernie Madoff would be proud of. The revenues in that particular program, which also are going to be used to finance the new entitlement program, and then assume that someday down the road they're going to pay long-term care benefits to people who pay premiums into that plan, that also is going to face significant risk of failure because of the way that they are counting the revenue. So it said it's going to be a net federal cost in the longer term, because obviously when you take premiums that are paid in today, use them to finance something, a new health care entitlement program, when there is a demand for those at some point in the future, when people who have paid those premiums decide it's time to receive the benefit that they're entitled to, you can't use those revenues twice. And so you've got all this double counting that went on in the course of this bill, which, again, as I said, understated the overall cost of the bill and also the deficit numbers that I think were attached to it. Now, that to me, this study, this analysis was just absolutely a bombshell in terms of the impacts of the actual implementation of the health care bill, and as I said, completely refutes all the arguments that were made that it would lower costs, that it would reduce deficits, and that it would improve access. All three of those points are refuted by the analysis that was done by the actuary at the Health and Human Services Department. Now, more recently, last week about this time, the Congressional Budget Office came out with a new report, and they predicted that the health care overhaul will likely cost about $115 billion more in discretionary spending over 10 years than the original cost projections. So the promises that were made about deficit reduction as a result of this, it was somehow going to save $143 billion over the 10-year period, now are reduced by $115 billion because, as we said throughout the course of the debate, that it's going to cost a lot to implement this bill, both in the form of cost to HHS as well as the cost of the Internal Revenue Service, which is going to be required to now impose the individual mandate that would fall on a lot of people across this country and the penalties that are associated with that. And so you've got all these implementation costs that are going to add an additional $115 billion in spending over the next 10 years, which reduce dramatically any promises about deficit reduction, not to mention what I just stated in terms of the double counting that goes on. My view on this is, not only is it not going to reduce the deficit, it is going to explode the deficit particularly in the out years when the demand for Medicare benefits comes and the demands of the trust fund. Those people who have paid into the fund and who reached retirement age, a lot of our baby boomers are going to require health care. The Medicare fund is going to be tapped for that, and there isn't going to be any money there because obviously it's been used to finance this entirely new entitlement program. And so you've got the actuary at HHS, you have the CBO now coming out with new information which completely validates the arguments that we made during the course of this debate, and that is that it's not only going to increase costs for most people across this country and increase taxes, but it is also going to have a detrimental impact on the budget and the deficit over the long term. Now, one of the promises that was made, that the good points, so-called good points in the health care bill, was that small businesses would benefit from a small business tax credit, and that's something that the administration has been trying to sell, that small businesses that have been putting notices out from the IRS, that there are 4 million small businesses that could qualify for the small business tax credit. But even there, that kicks in 2014. It's available for a couple of years, but as is now coming out, there are lots of fine print that I don't think people read very well. The Chamber of Commerce says that of all the small businesses in this country, about 78% of those small businesses are self-employed people. Self-employed people aren't covered. Families are not covered under this. And perhaps more importantly, there's a disincentive to hire people. We've got an economy where we're trying to get jobs growing and come out of the recession and get people back to work. And what this small business tax credit does is it says that it caps it, so that, in other words, if you get up to 25 employees, you're no longer eligible for it, and if your average wage is $50,000, you're no longer eligible for it. And so there's a real disincentive to pay people higher wages or to hire more people, because if you do, you're not going to be eligible anymore for the small business tax credit. And so a lot of small businesses are looking at this and say, what benefit is there to me in this? If I want to grow my business, yes, I could take advantage of this for a short period of time, a very short period of time, because it's about a 2-year window. But I'm not going to be able, if I'm at that threshold where you start hitting, and first it's available to businesses with fewer than 10 employees, and then it ramps up and it phases out at 25, but you get to 24 employees, and you're thinking, my gosh, I'd like to hire another person, but I'm no longer going to be eligible for the small business tax credit, or I'd like to pay my employees higher wages, but then I hit that $50,000 threshold, and I'm no longer eligible for the small business tax credit. It's a real disincentive to create jobs. And so one of the things that's being touted as a positive about this legislation is, in fact, in many respects, a disincentive for us to get people back to work and to create jobs. And so the overall impacts of this, which I think are still out there, I mean, I don't think we're going to know for some time, and in fact, CBO really has, I don't think, any idea about what this is going to cost in the second decade. They have some estimates, they can make some predictions, but they will admit that there's tremendous volatility in that and unpredictability when you get into the second decade. But the one thing we know in the first decade, one thing that we're finding out now as we get more analysis being completed, according to the HHS actuary, is that this is going to increase the cost of health care more than if we had done nothing. In other words, if we had done nothing and we still had health insurance costs in this country going up as they were at about double the rate of inflation, if we had done nothing, we would have locked that in. But now what we're going to do is we're going to continue to have health insurance rates going up, not only at that rate, but at a significantly higher rate to the tune of about $310 billion in more higher health care costs over the decade. And if you look at how that impacts individual people across the country, most, I think, Americans are going to see their health insurance premiums go up. And in fact, some of the provisions in the bill, there was also, as part of the, just recently, it was reported last week, that this provision that would allow people to keep their kids on their health insurance plans until they're 26 years old will, in fact, increase health insurance premiums by about 1%. That was something that was hailed as one of the virtues and one of the benefits of this legislation. But my point, very simply, Mr. President, is contrary to the assertions that were made during the course of the debate here with respect to lower costs, deficit reduction, greater access, none of that, according to these studies and analyses, is going to be the case. In fact, it'll be the opposite. You'll see higher health care costs for most Americans. You're going to see higher taxes for a lot of Americans. You're going to see higher taxes for certain, for a lot of small businesses. And I think you're going to see a lot of businesses who are going to just say, and we've already seen reports of that, as a lot of these businesses look at the impact that it would have on their bottom lines, say, you know what, it costs me a lot to cover my employees. It might be cheaper for me to pay the penalty and to just shove them into one of the government-run exchanges. And I think that is something that we have yet to see the impact from. And my prediction would be that you will see a lot of small businesses, and perhaps for that matter large businesses, who will come to that very conclusion and say, it makes absolutely no economic sense for me to continue to provide health coverage for my employees when I can have the government do it and save my company a lot of money. And so unintended consequences are something that I think we have yet to see, but we do know for certain that the consequences of this legislation, if these analyses that have been completed and studies that have been done by those who are supposed to know a lot about this subject, and by that I mean the actuary at the Health and Human Services Department as well as the Congressional Budget Office, they are now saying higher insurance costs, higher premiums, and a significant reduction in the so-called deficit reduction that was promised by the administration. And furthermore, because of the double counting that is done in this, and the way in which Medicare revenues are double counted, Class Act revenues are double counted, even for that matter Social Security revenues, payroll taxes are double counted in this, dramatically understate the deficit impact and the long-term debt implications of this legislation and what it will mean to the next generation of Americans who are going to be stuck paying our bills. So, Mr. President, I say all that not to be the Grim Reaper. We tried during the course of this debate to illustrate as much as we could these very points, to make these points. We tried to offer amendments that we thought made more sense in terms of controlling costs, actually addressing the underlying drivers of health care costs in this country, as opposed to just expanding coverage, which is essentially what the legislation did. It will cover more people. In some ways, it's going to cover more people through putting more people into Medicaid, which is going to pass on more mandates and more costs to our states. You're already seeing a lot of governors around the country reacting to that, talking about how are they going to pay for this. But you've got the 34 million people, I think, additional people who are supposed to be covered in this legislation. About 16 million of those are going to go into the Medicaid program, which already under-reimburses providers and which also imposes huge new costs and huge new burdens on our state governments. So there's not a lot of good news to report about this, and I think that's going to be the case, Mr. President. And I think regrettably, we could have gone a different direction. We should have gone a different direction. But that being said, we are where we are, and I hope that over time we'll have an opportunity to revisit this issue, because if we don't, it's going to have a dramatic impact on future generations, on our economy, both in the short term and in the long term, as a result of higher costs built into the cost structure for health insurance, higher taxes that are going to impact small businesses and families across this country, and higher deficits for which future generations are going to be assessed and have to pay. So, Mr. President, with that, I yield my time.